Let's talk about optic neuritis. This is one of the more notorious relapses that can occur. It can lead to blurring of vision, loss of vision, pain in the eye, pain behind the eye, and be extremely distressing. Optic neuritis literally means inflammation in the optic nerve. The optic nerve starts in the brainstem and works its way forward to the back of the eyeball, so it's resting behind the eyes. Sometimes on a clinical exam, you can look in the eye and see that the back is swollen, although oftentimes you'll never see that because the swelling occurs back farther in the optic nerve itself. So sometimes a clinical exam might be normal. However, on an MRI, as we see here, the optic nerve that is the right-sided optic nerve is bright because it is lighting up with contrast. In other words, there is active inflammation occurring in that optic nerve, and that person is probably experiencing those types of symptoms. Typically, the vision loss with multiple sclerosis, optic neuritis, is in the center of the vision, and oftentimes it's painful. So there's different descriptions that patients provide of visual changes that may tip us off, yes, we think this is optic neuritis. It might be typical or atypical of MS, or it might not be optic neuritis at all. One of the most common tests we use historically to assess for optic neuritis or damage to the optic nerve pathway was called visual evoked potentials, or VEPs. There's a little pictogram here to show you sort of how this is set up and the pathway that it's looking at. But in summary, it's measuring the conduction of information through the optic nerve pathway and the visual pathway. This can try to localize if there's damage and slowing of that information processing. A test that has come more into favor of late is called Optical Coherence Tomography, or OCT, and this consists of looking at a box where there's a specialized camera that will look at the back of the eye and measure the thickness of different layers of the retina. This can assess for optic nerve health and damage, and also give us lots of other information, such as, is the optic nerve degenerating and slowly shrinking over time? As you can see in the image provided, this is measuring both the right and the left optic nerve. The small, brighter circle in the center of the top pictures represents the optic nerve, and then the information below is looking at the thickness of the different layers of the retina and the health of the optic nerve. The patient that we see here is doing fairly well, with most of the segments of their visual fields intact, all in green, which is the normal reference range. You can see at the very bottom on the left, there's a small wedge of yellow, which means that there is some mild thinning. If patients get into the red zone, that means that thinning has become more severe. What that represents is that there's more loss of tissue and more damage has occurred. If somebody comes in with optic neuritis affecting both eyes, that's something that is much less common in multiple sclerosis, and you should think about an alternate diagnosis. Of course, everything is a spectrum, and it could be a much less typical case of MS, but I'd just like to point out that there's different features of somebody's symptoms that point us in different directions diagnostically. When inflammation strikes the spinal cord, we call that transverse myelitis. Myel refers to spinal cord, itis means inflammation, and that's what we're looking at here. So if you see the image provided, this again is the spinal cord. We're looking at the cervical spine in the neck, and you can see the normal darker color of the spinal cord until it gets a little bit lower down in the image, and there's a larger, brighter spot which represents an inflammatory change. In this particular picture, the change that's present is much larger than expected for a classic MS relapse, and this might tip me off to look for a different condition or mimic of multiple sclerosis. Transverse myelitis can affect lots of different bodily functions and sometimes lead to very severe and disabling symptoms. It can affect the arms or the legs, it can affect the bowel or bladder, it can also affect the motor, strength, or sensory functions. Sometimes it leads to spasticity, sometimes it can cause pain that can be quite severe. Transverse myelitis is not something we like to see and definitely like to treat very quickly and try to get back in front of. Much akin to optic neuritis with the visual evoked potentials, we used to assess patients with somatosensory evoked potentials, or SSEPs. This is a similar test consisting of placing electrodes in certain locations and then measuring the conduction of information as it flows from the brain to the spinal cord and the limbs. It can also help to localize damage that has occurred. This test is not used as commonly at this point in time because, again, the MRIs have been so much improved in their quality and the information that they can provide. However, it can still be used.